We're wrapping up Heart Month, and today for Wellness Wednesday, we're taking a look at congenital heart defects. Those are conditions present at birth that can affect the structure of a baby's heart and the way it works. Today, Dr. Cassandra Sung, who's a pediatric cardiologist at SSM Health, is here. Thank you so much for joining us.
Of course, thank you for having me.
So what types of congenital heart defects do you see most often in your work?
So I see a wide variety of congenital heart defects that can affect how the blood flows through the heart and out to the body. Can range anywhere from mild, where there's a small hole in the heart, to more severe, where there's missing or poorly formed parts of the heart.
Absolutely. And babies are born with these defects, but most of them, are they detected right away, or do we find out later into a child's life?
So it depends. Some congenital heart defects can actually be found during routine anatomy scan, ultrasounds of the baby when the mom's pregnant. And then if a congenital heart defect is suspected, a much more specialized ultrasound of the baby's heart may be done, called a fetal echocardiogram. Other times, if the heart defect is suspected after birth or even later during childhood or adulthood, the healthcare provider may order more tests such as a chest x-ray or echocardiogram, which is the ultrasound of the heart, or a cardiac MRI or CT scan.
If there's an undetected congenital heart defect, what are some of the signs and symptoms that people should maybe be aware of and keep an eye out for?
So it really depends. There's a broad spectrum depending on how severe that heart defect is. For the more mild cases, they may not have any signs or symptoms, or have very few signs or symptoms. Others, can present soon after birth. So a baby, for example, may show having some bluish discoloration of the fingers or toes or lips. They may have difficulty with feeds, so increased work of breathing or sweating specifically with feeds, or tiring out with feeds. They may also just have increased work of breathing in general and breathing fast. They may have poor weight gain. For older children, they may present with being tiring easily during exercise or having difficulty breathing during exercise. Whenever a child faints during exercise, that's always a red flag for us as well.
If parents are noticing any of those symptoms in their kids, what should they do? Do they need to immediately go to their doctor, or are there any intermediary steps there?
It depends. If it's just increased work of breathing or tiring with exercise, then I think they should be seen by their primary care provider. Fainting during exercise is always a red flag, so they should probably be seen in the ER if that happens.
So Dr. Sung, medical care and treatment for congenital heart defects has progressed.
Yes.
What does that mean for these babies who are born with these defects, and then as they grow into adults?
So there's actually more adults now with congenital heart defects than children, just because there's been so many advancements that have been made with surgery and just modern technology for these children with heart defects. So they're going into adulthood, they're doing well, leading independent lives with little or no difficulty. Some of them do have genetic defects associated with these heart defects or other associated medical conditions, so they may have increased disability related to that. But a lot of times they do pretty well. They may develop other health problems as they get older, depending on the severity of their heart defect. So it's just really important that they maintain, regular visits with their primary care provider and their cardiologist, in case they need future surgeries after initial cardiac surgeries are done.
All right, Dr. Sung, a really important issue. I know all of us here at 27 really care about this. So thank you so much for being here today and sharing this information.